The following presentation demonstrates Trim PEMA temporary crown and bridge material. The same technique may be used with Trim Plus PMMA temporary crown and bridge material.
Hello, I'm Dr. Rick Bona with the Bosworth Company, and today I'm going to talk about the use of Bosworth trim material for the construction of a temporary bridge. To construct the bridge, we're going to use several Bosworth products, one of which is their trayaways. I like to use their perforated trays for better retention. Their spray called Tack, it's an alginate adhesive. Super Gel, alginate impression material. And then to help lubricate the prepared teeth in the mouth, I like to use their mask lubricant. And then of course the trim. Trim comes in two styles, if you like to call it. The basic trim comes in a light and a dark powder to mix with the liquid, the monomer. And then Trim 2, which gives you the opportunity to use 6 different shades in the A, B, C, and D ranges. During the fabrication of the temporary bridge, we will also use the Bosworth pressure pot. We use the pressure pot to construct a harder and also a quicker set temporary material. It is use of either room temperature water or a little bit warmer water to increase the setting time. Finally, after the fabrication of the temporary bridge, we will trim it, adjust it, do any additional add-ons to the margin or if there's any voids, and then final polish, and then the application of the Bosworth glaze to give it a beautiful sheen. The model we're going to use for the demonstration is a dental form in which I have removed one of the teeth and placed wax. So a patient is now coming in with a missing tooth, and we are going to construct a temporary bridge after the preparation of the teeth. First of all, in the mouth, we'll use one of the trayaways, fitted for size. Once that is good, we will then apply the tack adhesive. The material is very sticky. I apply it where I'm going to put the alginate, and occasionally even outside for additional retention. Gently fold it into the tray so you don't get any voids. Then I come to the patient's mouth and I gently seat it in the patient's mouth for the construction of the permanent bridge. We will cover them with the Bosworth mask lubricant, silicone lubricant. Of the unprepared teeth, and I use the B crown with some wax to stabilize it. Okay, it's set up very nicely. Remove this. The pontic with the wax popped out. So I'll just grab that, pull that out. Save this model for the laboratory so they could have an idea how the teeth looked and what I constructed. Okay, now we have a beautiful impression of the models. There's some excess I like to just trim off. Now sometimes what happens is a practitioner may put too much, or if they have their staff doing this, in which will overflow everywhere. And it will not really mimic the mouth. So once I have this, before I fill it up with the trim, I always like to go back and practice going in the mouth to make sure everything fits right. Model for the temporary bridge, we now get the trim. Once again, there are 2 boxes or types of trim. Trim 2 has the multiple shades, and they also have a wonderful little pipette. We'll use the pipette, draw some of the liquid. It is calibrated. It's nice, you have some control, it doesn't spill all over. We are doing a fixed bridge. The material is very affordable, so I'd rather have extra than too little. Like I said, I'm going to use the dark powder, and I'm going to start flowing it in. spatulate gently to wet the particle so it's not lumpy. As you can see, they're getting wetted. Now I'm getting a nice creamy material. I like to go with the spatula and keep just working it off the side. I don't really want to mix because I don't want to trap any air bubbles. It causes voids. And the rolling will just help keep wetting the particles nicely. I'll put just a little bit more, and basically rule of thumb is once you start seeing the powder gently, slowly get wetted, it's usually ready to be used. Okay, it's nice and creamy. There's one little bubble, but basically it's pretty solid. Now the next trick is to try to flow it in nicely into the prepared area. Now I took that off the model, and here's abutment, pontic, and abutment. Now what I want to do is make sure I get enough around the margin, so I will generally go with a periodontal instrument or a lab knife, and I will scoop away a little bit of the interproximals and of the margin area. So this way I can get nice margins on the material. It will flow nicely. And it's just gently trimming. Okay, so the areas of the abutment, the pontic and the abutment are ready. And the consistency is just beautiful. I like to try to flow it in gently and nicely, right in the middle, and let it flow into the cusp areas. And usually start one area and then let the material roll into the others. I do not want to lump it in, clump it in, because then I will trap air and have voids, which I will have to be patching up. And you can see how the material flowing towards the back motor, and I just like to work it in. I have plenty of working time. Basically, you have several minutes. And the hardest part is to decide if I have enough. Now this is a bridge, so this area is needed for the pontic area, so I'm going to put a little bit more to make sure it flows nicely over the margins.